Something I hear from my rheumatoid arthritis patients all the time is this: the joint pain I can handle, but the fatigue is what I just can't deal with. Not just tired, but the kind of exhaustion where getting through the day just feels overwhelming. Where even simple things like cooking dinner or running errands can just be overwhelming. And if you have RA, you may know what I'm talking about. So today I want to talk about RA fatigue, why it happens, and what you can actually do about it. I'm Dr. Neha, rheumatologist. Let's dive in. One thing that's really important to understand is that RA fatigue is not the same as normal tiredness. It's not just a matter of needing more sleep or a lack of motivation. RA fatigue is a real biological symptom of autoimmune disease. Your immune system is active, there's inflammation in the body present, and that can affect the energy level in so many ways that people don't even realize. So let's talk about why fatigue happens in RA. Most of the time, it's not just one cause. So as we go through this, I want you to think to yourself, which of these things could be bothering me? Usually it's several things that are happening at once. And only when you can identify these would you know which ones to treat. So cause number one, the first and probably most important factor is the inflammation itself. In RA, the immune system is producing all these inflammatory signals everywhere, whether it's IL-1, IL-6, TNF-alpha, or other cytokines. And these inflammatory signals, they're not just affecting the joints. They can also affect the brain and nervous system. In fact, inflammation can affect areas of the brain that influence energy, mood, and sleep. That's one reason why fatigue often becomes way worse when you have flares of RA, because inflammation is more active. When your immune system is in overdrive, just active all the time, not settling down, your body is diverting its energy towards that immune response. This is sometimes referred to in research studies as sickness behavior. It sounds kind of odd, but it really is an actual part of rheumatoid arthritis. And it really refers to all of those symptoms that are not your joints, like not the pain that you're having in your fingers and toes. This is different. This is that fatigue, that tiredness, the brain fog, having a low mood. You don't want to talk to people, you're socially withdrawing yourself, you don't want to eat, you can't sleep well. Those are all symptoms of this sickness behavior that you can see in RA. And they often feel like when you have the flu. It's something very similar. So it's not just in your head. Your body has now shifted its energy towards fighting that inflammation, and that can, not surprisingly, cause fatigue. The second cause is sleep disruption or poor sleep. So a lot of people with rheumatoid arthritis have difficulty getting deep restorative sleep. So not just sleep, it's that restorative part that's important. And there's so many things that can affect it. If you have pain, you're not going to sleep well. You might be moving all over the place. Same with if you have stiffness and your joints just feel the need to move everywhere. Otherwise, you have all this discomfort. But another reason is that inflammation actually affects that quality of your sleep. So you might be in your bed thinking you're sleeping for 8 hours, but it may not be this great restorative deep sleep that you really need to recharge your batteries. And if you have poor sleep, that can make your fatigue worse. Our third factor for causing fatigue in RA is losing muscle mass. I know it's not something we often talk about with rheumatoid arthritis. We talk about it with lots of other things, but losing that muscle is really important and it can contribute to fatigue. When you have inflammation, you don't feel like moving. So your physical activity goes down and you lose muscle mass over time. But muscle is actually incredibly important for energy production in your body. It helps with metabolism, endurance, and physical function. Muscle supports those bones, joints, tendons, ligaments. So if you don't have good muscle mass, those areas could hurt more. So when muscle mass goes down, people often feel weaker and more fatigued. And you often see a cycle because when you feel exhausted, you're going to be less active. And when activity level goes down, muscle strength can also go down. And that can make fatigue worse. So over time, it can become this cycle of fatigue that's causing this decreased activity. And that decreased activity is leading to more fatigue. So we need to break that cycle. Cause number 4. Anemia. But be careful with this one because there are so many different causes of anemia. Some of them are related to RA, some of them are not. Regardless, anemia can definitely cause fatigue. So inflammatory conditions like rheumatoid arthritis can affect how the body produces red blood cells. And when red blood cell levels are lower, the body carries less oxygen. And oxygen is essential for energy production in the body. So anemia can definitely contribute to fatigue. So when you go to your primary care doctor and you report fatigue, right, because not all of it is related to RA, they usually check your thyroid, your vitamin levels. But another thing that is often checked is your iron panel. And within it, so a lot of rheumatologists, when we get blood tests, you may think that we're testing iron levels, but we're usually not, only sometimes. So usually what we're checking is hemoglobin, but that doesn't reflect your iron level. So sometimes you also need separate tests for that. And I certainly have people who are taking iron or they're getting iron transfusion, and that can be helpful if you're a candidate for those. Cause number 5. Finally, there's the overall burden of living with a chronic condition like RA. It is a chronic inflammatory disease. It's not something easy that's just going to go away with a pill. I wish it would make my life much easier. But having pain, inflammation, sleep disruption, medications, stress, all of these things together can affect the body's energy levels. And most people with RA fatigue usually have more than one of these going on. Because you're a regular person, you're allowed to be stressed out in life from different factors like your partner or your job, or you're taking care of your parents, your kids, any of that. It's not a neat little silo that things can fit in. But one thing that can be very confusing with RA fatigue is that the fatigue doesn't always match the disease activity perfectly. You could have well-controlled RA, no pain in your joints, your tendons, ligaments, anywhere else, and yet still struggle with fatigue. And that's because fatigue has multiple causes, not just inflammation. Fatigue is actually such a big issue in RA that one medication even studied fatigue specifically in its clinical trials, and it says on the label of the medication when you take that medicine that this can help fatigue. But all of our medications don't always say that, although they can help fatigue, because clinically in the office when we are treating patients, a lot of the times when the inflammation is controlled, the fatigue gets better. I don't know if you've seen that before or how it works with you, but fatigue has so many different causes. So if fatigue has all these possible causes, what can actually help you feel better? Well, first of all, control the inflammation. That's the most important first step, is control that underlying inflammation. There's a lot of medications out there. Unfortunately, they don't all work for everyone. Sometimes it is a lot of trial and error. And I know I hear from my patients that you feel like a guinea pig because we don't always know which one will work well with you. And it takes forever sometimes when you switch to another drug, maybe a couple months, 3-4 months to really start feeling better. So people don't want to switch. But also know that inflammation driving fatigue could be one of the reasons you don't feel good. So sometimes it is worth the switch even though you have to wait a while to feel better. Because when RA is controlled well, a lot of people notice improvements in fatigue. Second, protect your sleep. Sleep quality matters enormously here. And there are so many things getting in your way when you have RA. It could be the RA itself. It could be hormonal changes, which certainly don't help anybody. It could be sleep apnea. Get tested. There is actually not only a medication, but also an implant now for this. Or fibromyalgia, which is very common with autoimmune diseases. There are so many factors at play. And yes, you should do all of the usual recommendations. Maintaining a consistent sleep schedule, limiting your screen time close to bedtime, no caffeine late in the day, etc. But it's also important to manage that nighttime pain. Sometimes you may need a little bit of medication help at nighttime so you can get a good sleep. There are actually sleep specialists now who do nothing but sleep. So if you've tried the usual ways, maybe you've gone to your primary doctor, maybe you've talked to your rheumatologist, and nobody can really come up with a great game plan, just know there are very sub-niche specialists now that just focus on sleep. Because that factor, sleep, is equally important to help your overall RA. Number 3, maintaining muscle. Maintaining that muscle strength can make a big difference in energy levels. This does not mean intense exercise. You can go for a walk. You can do light resistance training. I love resistance training, as people who know me know this. I think it's so important, but you do not need to be how your neighbor is. You stick to what you can do. Or even physical therapy. Sometimes when people have not done exercise for a long time, I like to send them for deconditioning to PT, because that can really help you focus on how to start getting that exercise without harming some of these areas in the process. And that PT can also help preserve muscle and improve endurance over time. Be patient. Number 4, nutrition. Yes, nutrition can play a role. Make sure that you're getting adequate protein, because when you have RA and inflammation, you may need a little bit more protein than the average person, but also balanced meals that help stabilize your energy throughout the day. And I've done lots of videos on nutrition and what can help there. Number 5, check your labs. As I had mentioned before, if the fatigue is severe or persistent, it's worth checking lab levels like your thyroid, iron panel, vitamin deficiencies. Vitamin D is common, B12 also is another common one. But the most important thing to remember is that RA fatigue is real. And if you're experiencing it, you're certainly not alone. When we identify the different factors that could be contributing to the fatigue, there are often several things that you can do to improve it. So identification is important. Fatigue is definitely one of the most frustrating symptoms of rheumatoid arthritis. And it's something that people really do have a tough time overcoming. But our goal is to not only stabilize the inflammation, but but hopefully help the fatigue along the way. And I'm actually curious about something. If you have RA, when do you notice fatigue the most? Is it the morning, afternoon, evening? Because for some people, fatigue is actually worse than pain. I'd be interested in hearing your experience. Drop it in the comments. And I'm Dr. Neha. I'll see you next time.